Why is respiratory therapy so specialized for muscular dystrophy? Imagine a condition that gradually weakens the muscles responsible for breathing, making every breath a little more difficult over time. That's what happens in muscular dystrophy, a group of genetic disorders that cause progressive muscle weakness, especially affecting the muscles used for breathing. Because these muscles are skeletal muscles, their deterioration leads to unique respiratory challenges that requiring very specialized care. In muscular dystrophy, the diaphragm, the main muscle that helps us breathe, along with the intercostal muscles between the ribs and other accessory muscles, slowly weaken. As these muscles lose strength, lung volumes decrease, meaning the lungs can't expand fully. This results in less effective breathing, poor cough strength, and difficulty clearing mucus from the airways. These issues increase the risk of respiratory infections like pneumonia, which can be serious. They also cause hypoventilation, where breathing isn't enough to meet the body's needs, especially during sleep, leading to sleep-disordered breathing such as sleep apnea. These complications are a major cause of health decline and can even be life-threatening, especially in the most common form called Duchenne Muscular Dystrophy. Because respiratory muscles are skeletal muscles, therapies that strengthen muscles, known as respiratory muscle training, can sometimes help. But this is tricky in muscular dystrophy. In early or moderate stages, carefully supervised training might improve muscle endurance. However, in advanced stages, forcing these muscles can cause fatigue or damage, making therapy risky. That's why respiratory therapy must be personalized, carefully balancing potential benefits with possible harm. Specialized respiratory care involves regular monitoring of lung function to catch early declines in breathing capacity. This helps healthcare providers decide when to introduce interventions. Lung volume recruitment techniques, like manual or mechanical devices, are used to help fully expand the lungs and prevent atelectasis, which is lung collapse. These devices assist with coughing and clearing mucus, reducing infection risk. Non-invasive ventilation, such as bilevel positive airway pressure, is often used during sleep or even during the day to support breathing when muscles weaken too much. This support can improve quality of life, slow lung decline, and extend survival. Secondary issues like scoliosis, a curvature of the spine, and chest wall deformities can further impair breathing. These may require orthopedic treatment or surgery to help improve lung function. Because weakened cough makes clearing secretions difficult, preventing infections becomes crucial. Vaccinations against pneumonia and other respiratory illnesses are vital, and prompt treatment of infections is essential to prevent complications. Breathing exercises and assisted coughing techniques are also part of the care plan to help maintain as much respiratory muscle function as possible. All these interventions highlight why respiratory therapy in muscular dystrophy is so specialized. It involves a team approach, combining regular assessment, mechanical aids, ventilation support, and preventive care. This approach is different from respiratory therapy for other conditions because it must adapt to the ongoing muscle loss and the risk of respiratory failure that evolves over time. In summary, respiratory therapy for muscular dystrophy is highly specialized because it must address the progressive weakening of breathing muscles, carefully use training and support devices, and prevent secondary complications. This tailored approach is essential to help maintain breathing, improve quality of life, and extend survival for those living with this challenging condition. Always remember, anyone with muscular dystrophy should work closely with healthcare professionals to develop a personalized plan suited to their specific needs.